Mr. Stakilo, thank you so much for joining us here today. Now, your report found that people seeking addictions treatments are not getting the service they need. So what were some of the key findings there?
Well, we looked to see if people were getting access along the complete continuum of care. So when someone is in recovery, there's multiple stages of recovery. So for each stage, we looked at how easy it was for someone to access it. And what we found was there is a lot of shortage of beds and facilities. And we found particularly in rural and northern areas, there was issues with either transportation or a lack of availability of spaces.
Now, court services are also named in the report. Can you walk us through a bit of that section?
Sure. In court services, what we looked at was what the Department of Justice does to provide the appropriate tools and resources to the judges and the courts to conduct their judicial process. What we found were a lot of barriers with respect to technology and to staff vacancies.
And last one for you here, what changes are you recommending for the protection for persons in care? You mentioned serious and systematic issues, so what's the impact of that?
Right, so with respect to that report, we had found that they were using a very, very strict interpretation of the term abuse. So they were concluding in cases where people were harmed that abuse didn't occur because it didn't meet their strict definition of what abuse was. So, probably the main recommendation in the report was that the government revisit the definition of abuse that is in legislation or the interpretation of abuse so that they can make these investigations and come to more reasonable conclusions.
All right, Mr. Stakilo, we'll have to leave it there, but we certainly do appreciate you coming on and giving us a bit of insight into this.
My pleasure. Thank you.